safety. And unfortunately, there's not very much to see. So my takeaway is that food and food packaging represents a very, very low risk of transmission of the COVID-19 virus. And that's really my sole takeaway. But what I'll do is take you through a little bit of a short COVID-19 journey and focus on food safety, talk about occupational health and safety, because this to me is the key issue, and what happens next. Food as a vehicle, when the pandemic was first announced in early March in 2020, WHO announced a global pandemic, and there was a lot of early misinformation about the virus and the possibility that food and food packaging might be a vehicle for transmission to people. From a hazard risk perspective, the potential risk of acquiring COVID-19 from food and food packaging is considered to be very low. And this was recently confirmed or stated very clearly by the International Commission on Microbiological Specifications for Foods, that issued a statement on the 3rd of September that confirmed the fact that food and food packaging represents a very low risk. And so since that time, or during the time of the entire pandemic, there's been a lot of discussion, a lot of research done on transmission and survival in droplets and aerosols. And also some work on fomites, which I'll talk about in just a moment. But the key risk communication that's been right from the outset and continues today and will continue into the future is the fact that we adopt very, very straightforward, very, very simple measures. It's about wearing masks, it's about good hygiene, washing hands, and maintaining physical distances of at least 1.5 metres. And in fact, that's probably on the lower end because of more recent information about the transmission via aerosols. I just want to dwell though a little bit on some early published work, and this was correspondence, so it was not peer-reviewed literature. This was published in the New England Journal of Medicine, where aerosol and surface stability of the virus, both the SARS-CoV-2 virus and the SARS-CoV-1 virus, were examined as aerosols and also on different surfaces. The two examples I'm just showing you here are cardboard and stainless steel, and the SARS-CoV-2, the COVID-19 virus, is the one that's in the red symbols on these graphs, demonstrates it survives for periods of up to 24 hours on cardboard and periods approaching 48 hours on stainless steel and even longer on plastic. So that correspondence confirmed that aerosol and fomite transmission of the virus is plausible, that the virus could remain viable and infectious in aerosols for hours and on surfaces for days. Now, this got a lot of people worried about food and food contact surfaces and fomites. And yes, it certainly is plausible, but this work was done under laboratory conditions. There were high titers of viruses that were used in these studies, and they didn't infer transfer to people. So very quickly thereafterwards, there was some information published in The Lancet from Emmanuel Goldman from Rutgers University in the United States, and he was quite damning about these studies and stated none of these studies present scenarios akin to real-life situations. So if you want to follow up, there's been quite a lot of literature since, but a paper that was published just 3 weeks ago, Frontiers in Nutrition, is well worth chasing up because it's got a good overview of the situation. So our concerns here are not with food and food packaging, but they're more about this transmission via aerosols and by droplets. And I'm just showing this graphic, which comes from a Spanish source. And this shows a graphic of where patient 0 had travelled from Wuhan and was sitting in a restaurant in an enclosed space with recirculating air from an air conditioner. And in the space of a 2-hour period, there was continuous recirculation of air amongst those 3 tables. And what we saw is patient 0 infected 9 other patients because of these virally charged micro droplets that were in the space. And these are the very strong messages which apply also in the food industry about people being in close contact for prolonged periods of time with stale or recirculating air. So during the 10 months that we've been in this situation of working with the pandemic, PMA Australia New Zealand has been very active in putting out information to inform both our members, the horticulture, fresh produce industry, as well as consumers about things that they can do to protect themselves. 7 steps for safe shopping, 7 steps to reduce COVID-19 transmission, actions for the food industry, sanitation, etc. So we've been very strongly pushing this focus on occupational health and safety, not food safety, but occupational health and safety. That COVID has definitely changed the way we interact with people and how we produce, we process, the way we consume food. And that the fact is that in our industry, we've got people often in close proximity in the field, but certainly in packing and processing facilities, distribution centres and retail settings. And with food, such a critical industry, it's important that we keep our work teams healthy and safe, and we need to do everything in our powers to do that. So for the industry, it's about managing and educating their employees. So it's all about organisational culture, and I strongly focus on culture, safety culture in the food industry, and that is more than just food safety. It's also about the safety, the occupational health and safety of our employees. So we published these guidelines for the fresh produce industry, COVID-19 and your workforce. We've published checklists, and just recently I authored this document, which has been published by the Australian Institute of Food Science and Technology on COVID-19 and your workforce, which has got diagrams and talks about simple processes by which we can protect our employees. So the reset for us is well, where are we now and what's going to happen into the future? The reality is that COVID-19 is here to stay. Vaccines and medication regimes are being researched, and we're seeing almost daily now information about the efficacy of different vaccination strategies. We're improving our understanding of transmission, the importance of droplets, but also aerosols, and we're understanding more about barriers and the efficacy of masks. But there's many unknowns. We don't know if immunity is going to be long lasting. The graphic there from Nature magazine shows that if immunity lasts less than 40 weeks, we're going to see annual or probably seasonal outbreaks. If it lasts more than 100 weeks, we'll probably see outbreaks every 2 years. So there's a lot of unknowns still into the future. So I'd just like to finish up by talking about some certainties. We've got certainties that we are going to have ongoing cases, clusters and outbreaks. There's no getting away from that. We are going to have intermittent lockdowns, and we're going to see probably seasonal surges as we're seeing in North America and Europe at this particular point in time. And the danger for us is that we become complacent. We're moving back to COVID normal, and in fact, it's almost normal. And people have got reduced protective behaviours and interactions where the virus can spread. So we need to be much more, or continue to be vigilant and continue to reinforce through cultural ways the importance of our employees following good hygienic practices. So thanks very much for the opportunity to talk this afternoon.